Good morning, everyone. Thank you very much for being here on a Saturday, and thank you very much for having me. I'm based in Boston, but I'm going to talk to you a little bit about my road to getting to Boston, and then to having the opportunity to come down here one weekend to say hello to all of you guys and to share a little bit about my own path. So let's start with what I am doing right now. So I am a neuroradiologist. I am based in Boston at a hospital called Massachusetts General Hospital. I did additional training. So in addition to being a radiologist and a neuroradiologist, I am also a pediatric neuroradiologist. That means I spent about 90% of my time looking at MRIs of children, anyone below 18. And when I was in my training, I was fascinated not just by the images of the brains of children, but I wanted to take it to the most extreme level. So I devoted a fair bit of my time to looking at the brain of fetuses. So before they were born, we put together a lot of effort into developing technology for fetal MRI. So you guys all probably have had MRIs or have met people that have had MRIs. And we wanted to make those advances and those advantages available also to the babies that hadn't arrived and that were in need of care. So I really enjoyed that because it was very different from what most people were doing, and I thought it was fascinating. So I ended up concentrating my academic time and my research time in that area. And nowadays, my week consists mostly of 2 days where I read MRIs, and 3 days when I'm doing research, trying to make all those MRIs better. And better may be faster, maybe crisper, but ultimately just loading them with more information that we can use to help the people that need MRIs, mostly children. So let's go to the next slide, please. So this is a little bit about me. I turned 40 recently, this past May. I was born in Colombia. I was born in Bucaramanga. For those of you who may not have been, it's a nice intermediate city. It's pinpointed there. It's close to the Venezuelan border, and I always tell people if you're coming in from Venezuela, it's probably one of the first large cities you ran into. I was there up until I graduated high school, and I loved science and technology in high school. So when I was thinking about what to do in college, that was definitely one of the things that stood out to me, is that I wanted to do something that had something to do with science. In Colombia, the medical school is a degree you join right after high school, which I must say, kind of like the American way, in that you have a little bit more time to figure things out, and you can go into college, start by doing sciences as part of your bachelor's, and then you can figure out exactly what branch of science you can take and which route you choose to take. I think that is not the case in Colombia, but I ended up choosing medicine. Largely because of two reasons. One of them was my interest in sciences, and I really enjoyed it and thought it was fun, and thought it would continue to be fun for the duration of my professional life. And the second one is, when I was in high school, my mom had cancer, and that was pretty shaping. She's doing well, fortunately. She is 70 years old now, and she's lived a happy life. But that was pretty powerful to see how illness and sickness affects people very profoundly, how it affects the entire family, but also how much things have changed. If it had been maybe 30 years or maybe even less earlier, maybe my mom would not be with us, because a lot of the developments that saved her life, which were in her case medications, were relatively recent medications. And I thought that was really, really powerful. And even if you're not thinking about it, those types of life events actually impact you. So I think that was a really big part that shaped what I do. After training in medicine, I decided to do radiology because I thought it was really nice and kind of techy. Meaning everything I do on a daily basis is based on some sort of digital community. Like I spend all of my day in front of a computer. The images are acquired by a machine. They're transmitted through the internet and wires to a different machine where I look at them. I don't actually type. I dictate everything I'm seeing and thinking. And then when I'm done with the report, I push a button, and that report goes into the medical record, into the chart of the patient. And another doctor, that's the doctor that ordered it, gets that information, and then they decide what to do with it. In medicine, I think it's become really, really widespread and more important to do imaging. I think if you go back 100 years, and we'll talk about that in a second, imaging wasn't here at all. So all the doctors could do was look at the patient, ask them where does it hurt, try to look with their naked eye and see if it was obvious what the cause was, but sometimes it just isn't obvious because it's way too deep. And then they could start to run blood tests, they could try their best, but there is something very powerful about being able to look inside the body without having to open it. And I think you would all agree that if someone were to open any part of your body nowadays, you would much rather that the person has taken a look before they open you, just to know, one, what they're going to get into, and two, what they can actually do about it. Before that, it was a little bit of a gamble, like it hurts, so we're going to open you and see what we find. Nowadays, almost every surgical intervention is preceded by some form of imaging. And along the same lines, almost every diagnosis and every visit you go into an ER will have some form of imaging, because it's just that powerful. And you have probably heard about some of those. Like, I would like to know, how many of you guys have had an X-ray? Right, they're very, very common. And they were the first form of medical imaging. It isn't the only one, but it was the first one. How many of you guys have had an ultrasound? Okay, plenty too. And a CAT scan? Okay, also a few. So a CAT scan is kind of a cousin of an X-ray. The first X-ray that they took is not too different from photographs that you take with an old camera before they were digital. Now that they're digital, our X-rays are also digital, but it was pretty much the same thing. The CT scan is kind of like an X-ray, but a rotating X-ray, so you get a lot more information. And then the more recent one in that list of tools we have are MRIs. And MRIs are awesome. They are based on the amount of water that tissues have, and that's super helpful. But the second nice thing about MRIs is that they do not have any radiation. So like ultrasound, they're completely safe. That's why we use it a lot in children, and that's why it's one of the areas that I specialize in. And same thing, we use it in the smallest of children, which are fetuses and unborn children. And we'll have an upcoming slide, but as an opening thought to that slide, no career or no journey in life is set on a single step. You have to take many steps to get there. And if we could go to the next slide, please. Thank you. So I wanted to point out some of the steps I took. By the way, not all of the steps always work out exactly the way you're thinking about them. Sometimes you explore a route, and sometimes things don't pan out, but you still learn something from it. So if we go through my journey, I started in Bucaramanga, went to high school in Bucaramanga. I moved to Bogota for medical school, and that was great. Bogota was a large city. I loved every minute of living in Bogota. And when I was there, I started to get curious about the possibility of doing research. And it had to do with that notion that I got about how rapidly medicine changes. So as I was saying with the case of my mom, but with many patients I saw, their own course was very different had they been ill or been diagnosed 20 years before. And that was fascinating to me. So I reached out to another Colombian, his name is Diego. He was in Philadelphia at the time. We had never met. He was a radiologist, and I told him that I was interested in learning more and learning from what he did. He's quite an accomplished researcher. And even though we hadn't met, much to my surprise, I was a last year medical student, he said, why don't you come and spend a couple of months with us as part of your electives? And so I did. So I moved to Philadelphia. I worked at their children's hospital. It's a beautiful children's hospital, and it is the first freestanding children's hospital that there was in the United States. And it was a great experience. And when I was done with that experience and about to go home and graduate from medical school, he offered me a job to return to Philadelphia and work with him in research. So I did that. And the next step was figuring out how to transfer my own training, which had all happened in Colombia up until that point, and plug it into a system here in the United States so that I could actually practice medicine here. I didn't go into medical school thinking that I was going to end up here, but here's where we were. So I had to do some digging, ask a little bit, and I learned that there was a pathway, and I learned that you had to take some exams and do some things. But that was the goal that I had set for myself at that point. I really liked sort of the type of practice and job that my mentor at that time, Diego, had, and I completed the exams, I went through the process, and I applied for a residency, which is basically subspecialty training here in the United States, and that's what got me to Boston. So after spending 2.5 years in Philadelphia working with this mentor, I moved to Boston, where I've been ever since. That was 2013, and that's where I did the remainder of my training. So in Boston, I did 4 years of radiology, then I did 1 year of adult neuroradiology, and then I did another year of pediatric neuroradiology. And since then, I've practiced up there in Boston. I want to highlight a really important piece that I just told you about, and is my mentor, Diego. He's played such a crucial piece in my career and my life. He was an incredibly accomplished person who, for no reason other than the desire to help other people and to give back to the community and just build a larger community, he helped me a ton. He opened a lot of doors. He set an example that I would want to follow, and he supported me in the endeavors I pursued. And nowadays, that figure of having a mentor is probably one of the more important things that I think helps us all in life, whether we call them mentors or whether we call them something else. There are tons of figures that help us get to where we want to get. Diego was definitely that person for me, and I would say that in my current practice, I'm no longer that young, but mentoring younger people that want to do something aligned with what I do is probably one of the things that brings me the most professional joy. I have a research laboratory that I run in Boston, and at any given time, I have probably 2 Colombian research fellows that are mini versions of me. They just finished their medical school in Colombia. They want to move up here, and they've now joined us. And they spend 2 to 3 years with us, sometimes a little less, sometimes a little more, on their way somewhere. And that somewhere may be with us, that somewhere may be somewhere else. I'm fortunate that many of them have stayed around and have done radiology, and say, my hospital is a fairly big hospital. Every year, 10 new people go to train into radiology. So and the radiology training is 4 years. And currently, each one of the classes has 1 Colombian resident, so 1 Colombian trainee that's going on. And that's an immense source of pride for me. I've also the source of a lot of jokes because 2 of those trainees have my name. There's a Camilo Jr. and a Camila. And I'm close to being accused of nepotism, but I assure you it has nothing to do with the name. So anyways, I just wanted to point out mentors are really important. I think sometimes you run into them organically. It's also okay to seek them. And things will go forward. And the time will come when you will also have the opportunity to mentor others. People don't usually realize how much they've learned through life, but everyone has something that they can share and give others. As I mentioned, it's probably one of the biggest sources of professional joy that I have these days. Next slide, please. So going back to those first days in Philadelphia, because that was my first job and my first sort of city where I landed here in the United States, I had a blast. The hospital was terrific. And when I moved to Philadelphia, it was, in the best of ways, it was a big, big difference. The hospital had so many resources that I had never seen. And one of the things that just blew my mind off was fetal MRI. I had just never seen that. Obviously, there are fetal centers and there is fetal medicine in Colombia, but it is largely based on ultrasound. There's nothing wrong with that. They're very, very powerful. They're cheap. They're portable. So it brings a ton of advantages for public health. You can literally bring the ultrasound machine to moms, and that's incredibly powerful. But it doesn't solve all the questions. I had never seen a fetal MRI. And when I saw the first one, I felt it was kind of a sci-fi movie. I couldn't believe that we could see inside the mom with that degree of detail. There were still problems, don't get me wrong, because if any one of you has had an MRI, you guys probably remember that it's a tight space. People don't like getting MRIs, let alone if you're pregnant. It's not the most comfortable thing. And people have probably told you, you have to stay still. If you move, the images are gonna come up blurry, and that's true. So imagine you have to go through a ton of acrobatics to get an MRI of a baby, because you cannot negotiate with the baby. So the baby will move, and you have to do a number of things. But I still found it fascinating that we could do it. And then I devoted some of my time and efforts later on to try to address those problems, particularly the issue of motion. And if the videos work, I'm going to show you a little bit of what we've done. I'm also emphasizing mentorship there, but I wanted to say that to me also brain development is fascinating, and seeing it from the earliest time points, I thought it was just incredible. Let's go on to the next one. And completely unrelated to my journey, I realized after landing there and spending some time in Philadelphia that it is a pretty iconic city in terms of the development of both medicine and specifically radiology. The first radiograph ever taken was taken in Philadelphia. And this is that radiograph. It was taken at the University of Pennsylvania, which was basically the institution I was in. It was the hospital was a block away from the one I was working in. And his name is Dr. Röntgen. You don't have to know that. And this is his wife's hand. And you can see the wedding band. But this is the first radiograph that was ever taken, and was taken around the year 1900. So it's old. Yes, it's old. It's not that old. And it's fascinating. As I was saying, before this, there was absolutely nothing to look inside a person's body. You had to open them up. And that was really, really transformative. I think it's remarkable that the first radiograph that's ever taken, and you can see so much detail. This is obviously a hand. You can see the bones of the hand. So up until then, you had to kind of look at a hand and see it looks crooked, it must be broken. So just think about how different this development really made medicine. And I was so happy that I was so close to a place that was integral to the development of radiology. Next slide, please. Now getting back to how we do this fetal MRI conundrum that I decided to put myself into. This is a very dear friend of mine. So she served as my model. She was getting an MRI. This was around the time of COVID. So you see she has a face mask. You don't need that for the fetal MRI. But it's a large production because, as I was mentioning, moms are not comfortable on their back. And so this position that looks like really easy, to your left, it's really difficult. It would be desirable, like that's probably what you would get if you were getting a spine MRI, but you can't get it in a mom. So you have to go through all these hoops, place her on her side, put pillows, put padding, and then put that gray stuff. That gray stuff is an antenna. And that antenna is what's gonna collect the signal from the baby, essentially. So when we do innovations, we have to really think outside of the box. Doing MRIs in pregnant women was different from doing MRIs in other people. And that was probably the first of the obstacles we had to bypass and jump over to be able to get this going. Can we go to the next slide, please? I'm gonna go quickly through this. This is a comparison. I was at some point skeptical of my own ideas. Like, yes, the pictures were really pretty. They were fascinating to me, but there's a difference between really pretty and useful. Those are not the exact same thing. So these pictures are on your left side. The pink and purple section is a section of a human brain, and you can see different layers and different cells. This is what the pathologist sees. And then towards the right side are images from an MRI. And then I kind of held them side by side to try to convince myself, like, are we actually seeing things that correlate and that are close, and they were. So I was very happy, and this was, even though it was an internal checkpoint, I was happy that I thought it was pretty promising to invest time of my professional life pushing this forward. Can we go to the next slide, please? And the next one again. These are questions that I wanted to ask when I was doing my fetal MRI research. So I wanted to get the technique down so that we could really get the best quality images, both to answer the individual questions of patients, as well as to do research to help us understand how the brain grows and changes before birth. That helps us in so many ways. Like, it helps us in the individual patient where we think something is wrong, but it also helps us in many other complex situations. Not all the diseases that affect pregnancy and young people are because of the baby. Sometimes they're because of mom. Mom can also be sick. Mom can have high blood pressure. Mom can have diabetes, and these things are going to impact the developing baby. So I wanted to create charts about how normal babies are growing. How is this second trimester pregnancy like other second trimester pregnancies, or why is it different? So I spent a fair bit of time on that. And what we really want to do is to bring all this data and technology together to improve the lives of babies and families. Nowadays, there are even fetal surgeries. So for a couple of things, you don't have to wait until the baby is born. The baby can have a surgery and still remain in the uterus for the remainder of pregnancy. And I think that is fascinating. Next slide, please. So I moved to Boston, and I already told you a little bit about it. I did first general radiology, that's 4 years, and then I did a year of adult neuroradiology. I think it's fascinating. I really like it. And something else is that MRIs are great for the brain. The brain is so soft and watery that you get all sorts of information. And we've nowadays used it a lot. My hospital is very large and very heavy on MRI. So we actually have a number that's insane to me. My hospital has probably more MRI scanners than most cities in Colombia. My hospital has 60 MRI scanners, which is bonkers. Like hospitals in Colombia where I grew up, they would have 2, and 2 would be a lot. Most hospitals wouldn't have MRIs, they would have CAT scans. So I thought that was a great place to train because I would have a lot of studies to see and watch. And then when I was there, I sort of went back to my days in Philadelphia. I worked at their children's hospital, which is called CHOP, for the Children's Hospital of Philadelphia. But I reached out to its sister hospital in Boston, which is called Boston Children's Hospital. And that's where I went and did an extra year of training. And that's where I'd learned, I would say, most of my craft in terms of fetal or pregnancy MRIs. And let's go to the next slide, please. And I want to show you one of the problems that we face. Okay, this worked, thank you. When we acquire an MRI, it works kind of like that. You're acquiring individual pictures, but it takes some time. So the baby is moving between them. They aren't quite aligned for you to look at them in an easy way. And can we do the next slide? So if you try to put this into or reformat this, they actually kind of make no sense. So they look nice individually, but obviously because the baby is moving, you're definitely losing information that you can live with, obviously, and I want to say this, some information is always better than no information. So even this stack of images as we currently do it, it's incredibly powerful. Coming from not having that to having that is very powerful. But for the next couple of years, I would say the first 5 years after my training, I devoted work to forming a collaboration with an engineer. Engineers are much smarter than I am, and they are used to thinking about problems differently. And that takes me to something that I think is really important in many aspects of life, but certainly in professional life, and it's the importance of collaboration. You won't get, I won't say you won't get anywhere, but you can get much farther if you work with other people. And I've always found it that working with people that are actually different, that have different backgrounds, different way of seeing things, different training, it's a little harder to get started, but it takes you that much farther. As you can imagine, if I sit around with other 5 people that all have exactly my same training, we can help each other a touch, but we're going to hit the same wall pretty quickly. So I formed a collaboration with an Iranian engineer who knew a lot about MRI and math, and he helped me with this problem. We worked together in how to put together those stacks in such a way that they were better and that they made sense. So think about it as a puzzle in 3D. He helped me collect all those pieces of information and put them together into an actual baby rather than cuts of a baby. And can we go to the next slide, please? Sorry. And the next slide again. So we can go over this. That's a bit too technical, but that's what our images look like after we implemented what we learned with Ali. So we took the individual slides and we recreated a 3D thing that we could play with. And that serves us in many, many ways to better understand the brain, getting rid of the problem of motion. Let's go to the next slide, please. So these are a couple of lessons I learned. There are always challenges. Some are financial. There's no roadmap. And not every attempt works. You're going to try some things, and some things will work, some things won't work, but you still learn from the things that don't work. And that's both in life and for personal growth, as well as for professional work. As I mentioned, my mentor was just a critical part of my career. Asking for help, it's a strength. You need to learn how to do that, because otherwise you're going to waste more time trying to do something. And second, you actually are frequently surrounded by more people that are willing to help than you realize. But if you don't ask, sadly, we are all too busy and we even miss the cues. Even when you're trying to help other people, you may miss those cues. And also, it's really important to have role models. I was so fortunate that my mentor and role model was also a Colombian man. That was fortuitous, but I was really fortunate that that was the case. And some lessons that I learned is you have to try, even if you fail. It's better to try and fail than to not even try. Stay curious, keep going, and as I said, success is built through a series of many steps. You won't just, I don't think, or maybe one of you is lucky, but I don't think you're just going to hit jackpot the first time you try something at the bat. So these are the modalities we use currently, and I wanted to show you things have changed a lot. So on the left side, you have X-rays. That's the most traditional one, and like I mentioned, it's really similar to a photograph because it's essentially what it was. Like photography, it has now become digital, so we don't actually have films anymore. I haven't seen. I looked for them because they asked me to try to bring some, and I couldn't find any in my department. They're a thing of the past. They're gone. Now they exist only in laptops, basically. And they're great to differentiate things that will stop the X-rays. So if you shoot an X-ray at the air, it just goes through. If you shoot an X-ray at a bone, the bone is hard, so the bone will stop the X-ray. So it's really good to differentiate things that have very different densities. Bones, lungs, those are great. The CT is just a circular X-ray. So it's the same principle, but you get more information because you sort of spin it around. MRI is my favorite by far. It depends, as I mentioned, on the content of water, which is also why it's so good for babies, because babies are very watery and they're swimming in water, so it's ideal. And the last one is ultrasound, also incredibly powerful, because ultrasound of all of these is probably the only one that you can bring to the patient. So it's a different beast, but it is super safe and you can actually carry it. Nowadays, you can actually buy one that you can fit in your pocket, and it gives you the ultrasound images in your iPhone. And that's remarkable. It's like we are trying to push that technology to bring ultrasound to places in Africa that just don't have the machines. And the fact that you can put it in your pocket, it's just remarkable. So ultrasound also incredibly powerful and useful nowadays. Let's go to the next one. So this is now a lot about what I do exclusively. So I do brain and spine imaging. That's what I do. That's what I like. I find what is wrong. So my clinical career, I find it very satisfying. Nowadays, really, most medicine relies heavily on imaging. Just think about it. If you go to the doctor and something hurts, he or she will order something to figure out why your elbow hurts. If you go through the ER because, I don't know, you have a stomach ache, someone's gonna get a picture of your stomach to try to figure that out. So I think radiologists, we are oftentimes in the back. You probably won't see us or talk to us for the most part, but we're constantly talking to your doctor. And we are kind of the middleman, yes, but we're backstage making sure that all the show goes on. And we help the care team decide what to do. So I like it very much. It's really entertaining and it's really dynamic, meaning on a single day, I can see images of 30 or 40 patients. That's how I like it. I can see, if you're a brain surgeon, you probably have time to operate on a single patient a day, and that's right, that's fine. I mean, if your surgery takes 12 hours, what are you gonna do? It takes 12 hours. I'm a little ADHD, so I like to move from one case to the other. I don't think I wanna spend 12 hours doing anything. I don't have that attention span. So for me, radiology is perfect because I get to see pictures from 30 or 40 patients in a day. And the way I see it, I get to help 30 or 40 people each day. And I enjoy it very much. Let's go to the next slide. The brain is awesome. I mean, it goes without saying, I'm biased, but I love what I do. It takes the most energy that you have anywhere, and each little piece of the brain is different from the next, and it controls something very, very different. And you can actually map all the functions into specific places. I think that's fascinating, and that's some of what I've studied in the fetus is how does that mapping develop? When do you start to use this part of your brain to move your hand? Why aren't you moving it when you were born, but you are now? So I think this is awesome, and the brain is it's remarkable in some ways, but it's also very fragile. So I find it fascinating. Let's do next slide. And Jashara, how am I doing on time? Thank you. Perfect. So these are a couple of the diseases that I see all the time, for which we have really good images. So strokes, they're remarkable. We pick up the earliest signs of strokes, and we can help people. So if you come up with a stroke and we tell another team member, a neurosurgeon, that what's going on is a stroke, he can go in and he can take the clot out, which is great. Brain tumors, same. Multiple sclerosis, or even if you have just trauma, and by trauma, I mean you fall down or in a car accident, we help the doctors figure out if there's a bleed in your brain and a clot that they need to take out, if there's a fracture, if there's all of these things, we are central to that. Let's do a next slide, please. I would say, as I mentioned enough, MRI is great for the brain, so let's move on. And I think that this is another really important point, at least for what I do. I've mentioned to you the importance of collaboration and collaboration with some of the people that I work, but I haven't done justice to all of the people that I work with. In my scientific career, working with engineers has been key. In my medical career, there are many people that have to stand in line in front of me for things to get done. So even if you like this domain, but you don't want to have the exact path I followed, there's plenty of opportunities. Particularly, let me mention some. There have to be technologies that take the images. I can't take the images and interpret them because it would be very inefficient. Every single image that I look at is the result of a collaboration of technologists that greeted the patient, took the patient to their machine that was going to take the pictures, acquired the images, checked the quality of the images, and then send them to me. And sometimes they call me and tell me, I think something's wrong. Do you think I need to do something else? Do you think I need more pictures? Do you think I need to reposition the patient? So the technologies, for example, are the patient-facing piece of my team. So that's one. There's nurses that have to be involved in some of the more complicated cases I see. For example, there are kids that need anesthesia to have their MRIs because they won't be able to stay still. Those kids require nursing. They require an anesthesiologist to put them down to sleep while we take the pictures. They need the technologists to take the pictures as quickly as possible, and then I look at the pictures. So there are many, many team members in each one of these spaces, in medicine, but also in science and technology. And I wanted to make sure that I said that because I haven't done justice to every single one of the people that I work with, but I could not do what I do if even a single one of them wasn't there. So nursing, advanced providers, MRI technologies, they're equally important. Let's go to the next slide, please. All right, and I think with that, we finished the first part of my talk, which was talking to you guys a little bit about what I do and how I got here. Is this a good time to share for questions, or do we leave them till the end, or what do you advise? Okay, then let's move to the other activity. So what we're going to do next, and I don't know how many people want to play, but I brought a reasonable incentive for those who want to play. So I'm going to show you actually how my day works. So I log into the computer, and what's waiting for me on that side, and we can go to the next slide, is something like this. Do we have a pointer? And if not, yes? Okay, perfect. So I'm going to show you kind of how my day goes and how awesome radiology is. And if one of you guys wants to play, I'll help you. You guys can phone a friend, and I'll be your friend, and I will help you through it. But I'm going to take the first case just to show you a little bit of how it goes. All right. So this is an X-ray. It's a chest X-ray. It's probably the study that we do the most. We do hundreds of this every day. And as I was mentioning, very good to differentiate things that really stop the X-rays, like the bone, from things that don't, like the air in your lungs. So let's start with the obvious things. What do you guys think this is? So that's the heart. We have very clean lungs. This is what we want the lungs to look like. Your lungs should be almost entirely air. Sure, there are some vessels here that come from the heart, but everything else here is clean. You have a little bit of gas and bowel, and you have bones that are healthy. So when I go into work every day, the first thing I find is a list of unread X-rays and things like that that need to be taken care of. This is a completely normal X-ray, so let's go to the next one. All right, and I'll see if we, I'm going to do something before we move forward, which is request some assistance. Don't go anywhere. So Jashira, if I can trouble you, I'm going to make you the CFO. You're going to be our Chief Financial Officer for the morning. And then the people who want to play, if they want to play, then you guys will talk to her. So I think there's a little of this. So all right, so let's go to the next case. So we'll have one of you guys, oh no, one before. Thank you. So let's ask for a volunteer or a microphone, and you guys can just tell me what you see, tell me what body part it is, and then tell me if you see something wrong with that body part. All right, we have a volunteer there. We have a radiologist in the making.
Morning. Well, I see a knee over there, and I don't know if that small bone is just a little bit up.
That thing?
The other one is the one.
Oh.
That one, yeah.
This one. So this one is your kneecap, and that's normal.
That's normal? Oh, okay.
So I won't torture you, but I will give you a prize. So this is these are radiographs of your knee. We typically do that. We take 2 projections to help us figure out what things are, because it's hard in a single projection. And these are completely, well, reasonably normal knees. I wouldn't say they're perfect, but they're completely fine. And these are normal. And it was that was the easiest case. So good for you for taking the first one, because that was the easy one. Let's go to the next one. So this one, so that you don't think I'm that evil, I put arrows, orange arrows in the problem. I don't want to develop a reputation down here. So this person came into the ED with abdominal pain. So does anybody want to tell me what they think is going on, or what they think it's abnormal? Remember, there's money in the line. Yeah, no one's going to die here. Yeah, también recibimos español.
I am not sure, but does it look like an appendix?
Yes, this is an appendix, and you know, I would want the things around the appendix. Yes, that's remarkable. Good for you. So you can even if you don't know much about CT, I think you can tell that this bowel loop, which was correctly identified as the appendix, looks a little different from these other bowel loops. Like the person has taken something, if you've ever had a CAT scan of your abdomen, they give you something to drink. And you see the healthy bowel, that contrast is actually going through. This unhealthy appendix is not filled because it's inflamed. And you see all this like dirty shadowing around it. That's different from this other stuff, right? So this is the inflammation around the appendix. So this is a typical case of appendicitis, and you can see how much we can help. Like you go in to the ED, and that's the difference between I ate something that wasn't quite right, didn't sit right with me, versus you need surgery. And and that's what this is. So thank you very much for playing. Let's go to the next one. All right, this is a little bit of an eye test. So this one is like it will be a good one. So another bone radiograph. What do you guys think? So this is a pelvis. There's pain in the right. I have a volunteer. We have. Yes, sí, puede ser en español.
Creo que tiene una fractura en la cabeza del fémur.
Oh my God. So he thinks, and then it's like a mic drop there, right there. So he thinks there's a fracture in the right femoral head, which is a remarkable observation. Good for you. Awesome. I'm actually really impressed. Just a touch scared, but let's go to the next one. All right, this is an X-ray of a child. We have a volunteer back there.
Wow.
See?
Se comió una moneda.
That's exactly right. He swallowed a coin. And this happens more often than you think. This is remarkable. You guys should all come to Boston and help me start my mornings. So this is what happened. Children put things in their mouth. Sometimes they swallow them. And that actually the distinction you made, you're 100% correct, but it can be a little more nuanced. Obviously, we have to do something about the coin, but it is actually an emergency if what the child swallowed is a battery. If what the child swallowed is a battery, the acids of the battery will basically eat through the lining of wherever the battery ends up. So with an X-ray, if you zoom in, you can actually make the difference. You can see the shape of the battery button, or you can actually see, I don't know how much is the coin worth, but in any event, this is a coin, and it's really important to recognize that it is a coin and not a battery, because it gives you some weight. Like someone's gonna have to do something, but you have a little more time. Good job. Let's do the next one. Ooh, this is another eye test. Well,
English, Spanish.
yeah, cualquiera de los dos. La persona tiene tos. This person came in to get an X-ray because of cough. And we already talked a little bit about how this should be. We want lungs that are dark like this, like the left side, where the air does not stop the X-ray, so it looks black. So you should look at the other lung and tell me what do you see within the other lung as opposed to the left. And I've stopped being nice, so I no longer put arrows. Now you have to work for it.
Is it fluid in the lung?
There's a little bit of fluid, but there's something else. So there is this rounded thing here that doesn't belong. That's a hole. That's a cavity. So this person has tuberculosis, and the bacteria has eaten a piece of the lung. So you have that literally a hole, and the lung is trying to sort of wall off the infection, so that's why you see a little white part around it and then a hole in the inside. So this person has tuberculosis. And let's go to the next one. Let's see what else I'm holding here. And I think this is the last case. So this is someone that has back pain, and this is my favorite modality. This is an MRI. This is if you're looking at the person from the side. We call it sagittal. And this is if you're looking at the person and sort of cutting it like this. And there's something here. And that thing is this same thing here. So does anyone want to take a, oh, we have a volunteer back there. Or two. I think if we have two, I don't know if we have two gift cards.
Is it a herniated disc?
It is a herniated disc. No, well, it is a herniated disc. So very painful, and some of you, I hope not many have had to go through with this. This is really interesting because it obviously is the source of the patient's symptoms. Patients really do suffer with this. We cannot see it on an x-ray because if you've seen, the x-ray would just show us the bones. It wouldn't show us anything else. So we would not be able to see the disc. And last, which is the best part, is we can do something about it. So now that we see where it is, we can have a neurosurgeon help you and take care of that disc. And I think that is it. Can we have the next slide? But I'm pretty sure those were all my cases.